Thank you, Mr. Chairman. Thanks for having this hearing. I'm sure you were probably watching the discussion we had with Secretary McDonald yesterday, and one thing that I was and continue to be very upset and concerned about is the recent Inspector General's report on the problems in Colorado Springs. And whether we call it falsifying or just bad training and poor record keeping, there were people on the wait list who went way beyond 30 days. And yet the records did not reflect that. And it was not an honest record keeping. It was not a proper record keeping. And part of the problem is also veterans who are eligible for the choice program, which we're here today to talk about, were not put on that list of eligible veterans. And that was a big problem and continues to be. Now, the claim is that these have all been fixed in Colorado Springs. I think the jury is still out on that because we are still hearing reports of people falling through the cracks, and that simply should not be happening. In particular, I know that you've already discussed this today, and I apologize, I was in other meetings up until now, so I don't want to, sorry if I'm covering old ground, but we have people, providers in the community who are not being reimbursed on a timely basis. And I know this is anecdotal, but we have one provider in particular who has had to stop seeing veterans because he has not been paid for 6 months. Now, how, in this day and age, even if we're using fax machines, how can this be happening?
Yeah, I appreciate those comments. And if you give me the name of the provider, we'll have our team. We have actually created a rapid response team to work with providers that are having issues. So please give me that name, and we'll be able to work on it. You know, we're doing like this two-pronged approach where we're driving towards the future, but at the same time we know there's problems in the current state, and so we're standing up and taking actions to address those. You know, I will say about Eastern Colorado, because I did watch the hearing yesterday and I did a little bit digging. They are in the top 5 in the country for utilizing choice. And so I think the idea, yes, I think we need to do better in making sure that everyone understands how the program works. But when I looked at it, I was like, wow, they're sending a lot of people out in the community. And I think people want, when I spoke with the medical center director and the VISN director, I think they want to see choice succeed in Colorado. And that, for me, was very telling, the fact that they are sending so many folks in the community. One of the things that I think I want to mention is you know, I looked at all these different reports that came out from the IG and GAO, and I think there's nuggets in there, there's themes in there that's important to put into practice. But as both of the co-witnesses here presented, this program has been evolving so rapidly. PC3 rolled out beginning of 2014. Choice, end of 2014. Got changed again in 2015. Those are only some of the law stuff. Continuously, we're making improvements on the program. So just imagine the level of training and really retraining that has to occur over and over again to learn new processes. We have not reached steady state yet, and in my mind that's good because I don't want to be at this state. I want to be at a much higher state of excellence. But when I looked at the reports there, a lot of them had to do with, you know, training and system issues. And I think hopefully as we continue to evolve and get to a better place, we're going to be able to deliver the care that we need to deliver.
Doctor, I hope there isn't still a need, although I suspect there is, of a culture change, an attitude change, that there are those in the VA who simply are not comfortable or resist having the private sector be more involved in providing veterans care. And I know you all know this, but I want to say it for the record.
Sure.
It's true that there are a lot of veterans providing health care within the VA system. That's wonderful. But there's a lot of veterans, at least in my community, in the private sector who are providing health care. And they also have the similar motivation to want to do a good job for their former colleagues in arms.
No, I'm with you. I'm a clinician, and I practiced at a VA, and then I've also practiced at academic hospitals and community locations and taking care of veterans. And I have a number of patients on my panel that I jointly care for with community providers. The fact is, last fiscal year, we had 1.5 million veterans, unique veterans that received community care. I think this trend is going to continue. I think we're going to, as we get a little bit better of level setting, what's going to be offered in the VA, what we leverage the private sector to help us with. When I talk to the doctors at the VA, a lot of them, it's their colleagues down the street that they're sending their patients to. So I don't know if it's a systemic culture thing. I think a lot of people welcome a community of practice.
Well, I hope it's not. Mr. Chairman, I'm going to yield back, but we will get you the name of that provider. Thank you.